If you're over 60 and you're taking any prescription medications, what I'm about to tell you could save your mind and your life. There are 9 extremely common medications that millions of Americans take every single day, thinking they're helping their health, when in reality these drugs are silently destroying their brain cells and triggering rapid cognitive decline. I'm talking about medications your doctor prescribed. Medications you trust. But the research is clear, these drugs significantly increase your risk of dementia, memory loss, and Alzheimer's disease. Here's the most terrifying part: many doctors either don't know about these risks or they don't mention them because they think the benefits outweigh the risks. But when it comes to your brain, nothing is more important. Once you lose your cognitive function, you lose everything. Today, I'm going to reveal the 9 most dangerous medications for your brain, explain exactly how they cause damage, and give you safer alternatives to discuss with your provider. Before we dive in, let me be very clear. I am not telling you to stop taking your medications today. Never stop a prescription without talking to your doctor first. What I'm giving you is the information you need to have an informed, life-saving conversation with your medical team. I've spent years researching the connection between pharmacy and cognitive decline, and the science is rock solid. These medications can cause damage, but in many cases, there are much safer paths forward. Your brain is precious, and you deserve to know the truth about what you're putting into your body. Let's start with one of the most dangerous classes, benzodiazepines. These are drugs prescribed for anxiety, insomnia, and muscle spasms, including household names like Xanax, Valium, and Ativan. They work by suppressing your central nervous system, essentially slowing down your brain. When taken long-term, they can literally shrink your brain. Studies show that people taking benzos for more than 3 months have a 50% increased risk of developing Alzheimer's. Beyond the long-term risk, they cause immediate brain fog that makes it nearly impossible to form new memories. There are natural alternatives like magnesium, L-theanine, or cognitive behavioral therapy that can manage anxiety without destroying your mental clarity. The second category is anticholinergics. You might be taking these without even knowing it because they are in everything from allergy meds and cold syrups to treatments for overactive bladder. These drugs block acetylcholine, a neurotransmitter essential for memory. Without it, your brain can't stick new information, and existing memories begin to fade. For seniors, the effect is cumulative. The longer you take them, the higher the risk. For allergies, switching to newer generation antihistamines like Claritin or Allegra, which don't cross the blood-brain barrier, is a much safer move for your mind. Then we have statins, which are prescribed to millions to lower cholesterol. This is controversial because your brain is actually made of cholesterol. It needs it to build cell membranes and neurotransmitters. When you aggressively lower cholesterol with drugs like Lipitor or Crestor, you might be starving your brain. Many patients report statin-induced memory loss. While they are vital for those who have already had a heart attack, for others, lifestyle changes and high-fiber diets might offer the same heart protection without the cognitive cost. We also have to look at proton pump inhibitors, or PPIs, used for acid reflux and heartburn. Names like Prilosec and Nexium are in almost every medicine cabinet. These drugs shut down stomach acid, which sounds helpful, but that acid is required to absorb vitamin B12. A chronic B12 deficiency causes confusion and memory loss that looks exactly like dementia. Often, simple changes like smaller meals, avoiding trigger foods, or elevating your head at night can solve the reflux without starving your brain of nutrients. When it comes to chronic pain, opioids are a massive red flag. Beyond the risk of addiction, these drugs reduce oxygen flow to the brain, causing permanent cellular damage over time. Physical therapy, acupuncture, or non-opioid protocols are often much more sustainable. Similarly, antipsychotics are sometimes given to seniors to manage agitation in nursing homes. This is a cruel irony. They are given to people who already have dementia, but they actually accelerate the disease and increase the risk of stroke. Finally, we must watch out for anticonvulsants used for nerve pain, corticosteroids for inflammation, and certain blood pressure meds like beta blockers. Anticonvulsants slow down the brain's electrical activity, making you feel mentally sluggish, while steroids can actually shrink the hippocampus, your brain's memory center. Even some blood pressure meds can reduce cerebral blood flow too much, leading to fatigue and decline. Talk to your doctor about switching to classes like ACE inhibitors, which are generally more brain-friendly. Your brain is the only thing you can't replace. If you are on any of these 9 classes of drugs, don't panic, but do take action. Bring this list to your next appointment. Ask if there's a safer alternative, if the dose can be lowered, or if the drug is even necessary anymore. Share this with your friends and family. It could be the most important thing you do for their future. Stay sharp, stay informed, and I'll see you in the next video.